Let's get to COVID now and the battle over whether schools should be open for in-person learning as the Omicron variant just surges across the country now. As you know, public schools are closed again in Chicago, where teachers are refusing to come to work, at odds with the mayor, who is determined to get students back in the classroom. Joining us for more on this, physician at Stanford Children's Health, Dr. Alok Patel. And Alok, I also have word right now that there's actually a press conference that's being held with parents. They're speaking about concerns right now there in Chicago, so we are monitoring that live event. Meanwhile, what is your reaction to the Chicago Public Schools standoff?
Well, Kira, good morning. My reaction is just sheer frustration, and that is on the part of teachers, of CPS, of children, of parents, of everyone caught in between, because we've had so much time to prepare for this. And if we actually think about what is at stake right now, it's a lot more than just children's academic potential. It's also their mental health, safety, nutrition, and all of it. And it's a little bit more complicated than what is just thrown out on tweets. I actually spent some time this morning reading the proposal put forward by the Chicago Teachers Union, and it encompasses safety and screening, but at the same time, we really want to hear a transparent assessment of what the real issue is and how quickly we can get these kids back. And I think it is deeply concerning.
So what is your impression then? As you've been following this, you've been reading in on as much information that we have to this point. I mean, is in-person learning safe for teachers and students right now, you think?
Kira, it is if the safety mitigation measures are met. So including masking, ventilation, vaccinations, testing as we see available. If those are met, it is safe. And the thing that really boggles my mind is that if schools are considered to be unsafe when you have these conditions met, then how on earth are other businesses safe? How is it possible that we can see bars and restaurants open, but the elementary school closed? And according to some reporting from the New York Times last week, 90% of Chicago Public Schools employees are fully vaccinated. And so if the parents and pediatricians and advocates for child health are comfortable with them going back in school and 90% of the adults are fully vaccinated, and then we take care of the other mitigation measures, it's absolutely safe.
Yeah, it's getting political, and our kids are going to suffer. So what conditions and supplies do you think are necessary for holding classes safely? Just put it in perspective, because obviously there's other parents across the country looking at their kids' school and wondering, okay, is my child okay, even if they're not in Chicago?
Well, I think that's a very good point you brought up, Kira, because parents should actually be looking at their local districts and resources. So the first things first, we want to look at vaccination rates. If a child or a teacher or an employee is eligible for the vaccine and hasn't gotten it, it kind of takes away from their argument about schools being unsafe. Vaccination is first. Testing and screening is important. We obviously are limited supplies there, so we got to rely on those masks, those high quality N95 equivalent masks, or a surgical mask with a cloth mask in front of it. Ventilation is still also a great option. And all of this put together, mixed with the mild strain, will make this so that it is a safer place to be for kids than a lot of other options out there. Kira, I got to add one thing and give a shout out to Chicago Public Schools. We are worried also about children's safety and nutrition. And I saw a tweet this morning from Chicago Public Schools offering options for parents out there to still get a meal, to still get childcare, and to still find places to take their kids, because parents have to get back to work. They have to be able to do this while making sure their kids are taken care of.
Yeah, we've got to function. And more than 130,000 people are now currently hospitalized. You know the numbers, just shy of a pandemic high, by the way. So what does this number mean, you think, at this point as we look toward the future of the pandemic?
Well, Kira, I hope that this number is stratified, because right now it means a lot of things. It's encompassing those who are hospitalized primarily for COVID-19 reasons. It also encompasses potentially those who have been admitted for something else, maybe abdominal surgery, a broken bone or something, who then test positive. We would also like to see this data broken down into vaccinated versus unvaccinated, so we can further put the stamp on the fact that the vaccines work. People need to understand that hospitalizations and deaths will lag the number as well. We're expecting, obviously, to see a peak, but this is all a very big call that our hospital capacities are still surging. And you can hear in my voice right now how nasally I am. I am an exposed frontline worker waiting on a PCR result to know whether or not I can go back to work. And that is also a major factor in what is kind of completely wrecking our healthcare system right now.
Well, you better keep us updated, because we need you to let us know what's going on and to give you, yes, exactly, fingers crossed. Dr. Alok Patel, appreciate you. Thank you.
Appreciate you, Kira.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.